This video is intended to show us the process for how to properly return narcotics to the return bin in the Pyxis machine. So due to the national IV opioid shortage, we are now allowing our facility to let nurses return IV fentanyl, morphine, and hydromorphone back to the Pyxis machine, and this video will outline the steps of how to do that. So we're going to start from step one, like we're removing a med for a patient. So let's say we're going to go to our patient, we're going to pick our patient, and then we're going to remove a med. So either override or remove. I'm going to pull out 2 hydromorphone 2 milligram per ml syringes. So when the screen pops up, it asks me how many I'm removing. I'm going to pick 4 milligrams or 2 total syringes. Hit accept. It's going to move to the right and I'm going to hit accept like a normal remove med. I'm going to open it. I'm pretending to remove it. I have my 2 syringes in my hand. And now I hit accept. And now let's say for whatever reason the patient did not need to use these 2 syringes. So you want to return them instead of just wasting them and throwing them in the trash. So what we're going to do is go back to our patient, and instead of remove, we're going to hit return. So we click return, and then the screen will pop up with the drugs that are eligible for return. So in this case, the hydromorphone 2 milligram per ml will show here. So you click it, it'll move to the right, similar to remove, but just in this case return. And it will pop up and ask us how many we are returning. So when we do this, we're going to have to put 2 because we have 2 syringes in our hand. It's defaulted to 1, so we enter 2, hit accept. And one thing to note is that this is set up exactly how waste is set up. So we're going to need a witness. So you're going to need a witness when you're returning these to the return bin. So you have your witness enter their credentials before actually placing them in the return bin. So once the witness enters their credentials, you record the amount and hit accept. Do not hit return to pharmacy, make sure you hit accept. When you do that, a receipt will print out, and this will document exactly how much you just recorded on your transaction, so 2 hydromorphone syringes. What you do with that is you take the receipt, your actual drug, and place them in a clear plastic bag. And there will be clear plastic bags in every med room. You take the drug, the receipt in the bag, place it inside the return bin, and you're done.